there. This is Dr. Tiffany Meyer,
Hello, good afternoon. My name is Dr. Alifiya Tyabji.
and we're social distancing, so we're gonna take our masks off.
Well, thank you for joining us today for our Facebook Live on a very relevant topic that we would like to address with you. Something that we've never really talked about, we've never really been educated upon
Trained in.
ourselves. So this is going to be a first time for us as well.
Absolutely.
So most of us are going through some major adjustments in our lives due to the pandemic. Parents especially are trying to juggle a lot with everything going on. They feel stretched. They are stressed and stretched thin with juggling, taking care of children, working, teaching, work, depending upon whether they're essential workers and they still have to go into their office and try to find childcare,
Right.
or trying to work from home.
Right. So parents are wearing so many different hats right now, and that's parents are stretched thin, and that's wearing on their children, right? Their teenagers and their children. So
Absolutely.
that's kind of the basis behind what our talks are today. Is we're going to talk about two major talks today.
Absolutely. And in addition to the pandemic, now,
Right.
in the light of current events, we have now this additional emotional toll for a lot of people with racism, the tragedy and protests that are occurring throughout our country. And as you said, Dr. Meyer, it's really, affecting most of us, including our children, and harming their health and their mental health.
And our children, our teenagers are asking lots of questions, and they have their own opinions. And so we wanted today to kind of give you a little background and maybe some tips to kind of help you as a family get through this.
Absolutely. So the first topic will be how to discuss racism with your child. We recognize racism is a public health issue. Now is the time more than ever to talk to your child about topics like racism, equality, and empathy, which is an uncomfortable and difficult topic for a lot of adults to address. And so we're here today just to provide you with some tips on how to address this with your children. And by doing this, hopefully it will, alleviate some of the emotional effects on yourself, but also for your children.
Absolutely, and we realize, as many other people do, that this is a very difficult and uncomfortable topic. It's hard to approach it. It's hard to kind of bring it up. But sometimes, a good time to bring this up may be when you see something on the news, or a friend comes up, or a friend calls and talks about something. So that may be the time, that's the time you can sit and have a discussion.
Or if your child asks you a question.
Absolutely, that's a perfect opportunity to discuss it.
Developmentally, it's surprising, but babies as young as 6 months of age, they notice differences in race. And,
That's right.
and by the time they're 2 to 4 years of age, even before they start elementary school, they start to understand racial bias. And my son goes to Fairfax County Public School, and they do a really good job teaching them about empathy and appreciating diversity.
Yes, absolutely. And even by the age of 12, many children have really kind of become set in their beliefs, and they have their own strong beliefs by age 12.
Which is why it's really important for parents, even at a young age, to really start talking about different cultures, diversity, and embracing the differences in people.
Absolutely. And racial bias is something that's kind of learned. And so, as a parent, if you can model good behavior and tolerance and emphasis on diversity from the beginning, that's very, very important.
Yeah, I didn't even realize this until I started researching that, it's like a language, and when you're immersed in a language, it's like being immersed in a society, similar to being immersed in a society where your child is going to gain that fluency at a young age, and they're going to be exposed, even when parents don't do anything about it.
Absolutely, right? Just going to school, right? They're exposed to different things. So. child is too old or too young to approach these concepts with them, and it may be a different approach. You'll talk to a 5-year-old differently than you'll talk to a 15-year-old. But it's really important that this stuff is brought up and that these conversations do occur.
Right, and every family is different, so this conversation may be different for Black families or non-white families,
Right.
and for white families.
Right, absolutely. And just important to have these open and honest discussions and conversations.
Absolutely. And as we had mentioned, right now kids are going to have lots of questions about the pandemic and what they can do to stay safe, but also now with the protests and the tragedy that's occurred, they're going to be asking questions as to what these protests mean. Why are people angry? I see signs around town. What does that mean? And then I feel, it's a little scary, but they're going to ask, well, why are these people being, harmed or killed by policemen, which is, they're always taught to trust them.
Exactly. And they're even going to ask, maybe, am I safe, right? They may worry about their own safety.
Absolutely. So just having those open, honest conversations, and then with the young children, just reassuring them and what you are doing to keep your family safe.
Right, exactly. And trying to stay positive as much as you can, at least definitely in front of your children.
Absolutely.
And then, tip number 1, we want to give you some kind of guidance and some tips, is just check in with your child, right? I know everybody's busy, everybody is working, children are doing their schoolwork or playing, but really just check in on a daily basis. Does not have to be long, even a 5-minute check-in. Ask how your child's doing. Just spend a little time, maybe it'll be at dinner time, just to check in and see how they're feeling. Do they have any questions?
Or even going for a walk with your child. And just ask, what did you see today? What did you hear about? How are you feeling about this? And you know your child best and what they're able to handle.
Absolutely. And just listen, right? The older kids sometimes really like to talk and tell you what they think and what they're feeling. So just be there just to listen.
So advice number 2 is, watch if there's any changes in your child's behavior. As we mentioned earlier, we're all going through a lot of different emotions, and your child will be as well. And so look for signs of anything concerning, changes in their mood, their personality, where they may become more aggressive, or they may be more withdrawn or scared.
Right, absolutely. Just, don't just to brush it off. Just, really take note. Has my child changed? Is my child acting much different than he or she normally acts? In young children particularly, anxiety and worry and sadness don't present the same way as they do in an adult or maybe an older teenager. Anxiety may come out as anger or aggression, but it's really the child's worried and they're lashing out. So really, just take note of the differences.
And if you do have concerns, try to see if you can work with them on different coping strategies. Talk to your pediatrician. We're here for you to address your mental health concerns.
Absolutely.
Advice number 3 is the big one: limiting the exposure to media.
Right, and I know this is a hard one, right? Because right now kids are exposed. Even if we weren't kind of in the shutdown mode, kids are exposed to media in their daily lives in so many different ways. And with virtual learning that's been going on over, computers and stuff, obviously they've been more exposed to media. So just try to limit the amount of media time, especially as schools are finishing for the year and some are starting more. Really try to put a limit on it, get your children outside more, away from either TV, the iPad, the computer, whatever it is, the phone.
Even, watch during your conversations with other people. They're always listening and taking things in, even when you don't think they are.
Right.
So we just really recommend not even having the television or radio on.
That's right.
When they're around.
And older kids, it's okay for them to, read the newspaper or learn, watch the news a little bit. But if you find your child is really affected by it, it's definitely a time to limit that exposure.
Right. And, teenagers especially right now on their personal devices, they're chatting with their friends. They may be seeing things. So it's always a good idea sometimes to kind of check in with them, maybe watch things with them, and just have an open line of communication with them. And I feel like most importantly, just really make them aware of what's true information and what's disinformation.
Yeah, absolutely. That's as Dr. Tyabji said, watch it with them, and so you know exactly what they're watching, and you can make a comment on it too.
Absolutely.
And then there's another thought too. Teens may also want to get involved in the protests, and you have to discuss that, and you have to figure out how safe you feel that is for them. Because sometimes the protests do become violent. So I think you have to listen to their concerns and their wants, but also make a decision on how safe that is too.
Absolutely. I know that there have been some peaceful protests where it's been more for families. So you can, if you choose to, you can go as a family and allow your teen to have that experience, to feel like they're contributing to trying to make changes. So our advice number 4, be aware of your own emotions. Your children can sense when you're not feeling well, when you're stressed and when you're anxious, and then that puts a toll on how they're feeling.
And so, as a human, you're going to be stressed, you're going to worry, you're going to be sad, but just recognize it and try to find ways for yourself to de-stress. So if you're upset, take a walk, do something for yourself just to so that your emotions are not going to spill over and affect your children also.
And if you feel like things are not going well, speak to your significant other or another family member. Maybe they can watch your child for a few hours, just again for you to kind of take a break.
Exactly. With the help of a spouse or a family member or friend.
And if you really feel like you're not doing okay, then it's okay to ask for help, and you may need to speak to your primary care provider.
Sure, absolutely. And tip number 5 is use this as a teachable moment. So we've kind of said this already, but really, as these topics come up, as your child asks the question, as you see something on the news, as something comes up, use it as a teachable moment. Discuss what racism is. Discuss what's been going on in our country over the centuries, and use this to teach your children about history, but then how to make changes and improve things too.
Yeah, this is a great opportunity, to do this for parents to be able to speak with their children, and some things that we've been doing, and I know other families have been. There's been some really good things on TV. So, for example, there was that CNN Sesame Street Town Hall that I thought was really age appropriate. And there are other similar types of series being aired on TV. There's movies that you can watch together. There's one documentary, I don't know if you've seen it or heard about it, called 13th, that I heard is really good. And this kind of helps your children to understand the difficulties. Absolutely. There's a book and a movie, The Hate You Give. That's another one that you can read the book and compare the movie. And you can do these events as family. There's lots of resources going around about different ways to talk to your children about racism, and a lot of movies and books to kind of help with this. And even movies that show a positive portrayal.
Absolutely.
Of Black and
right, and that's the whole thing, right? Is to show the positive portrayal of diversity. So,
one of my favorite books that I would read to my children, it's more toddler appropriate, is A Snowy Day.
Sure.
And if you're not familiar with it, but it's a story of a young African American Black boy during the winter. In a city, and he goes out to explore outside of his apartment in a snowy day. So, and there are a lot of kids appropriate,
different age appropriate. And I know right now libraries really aren't open, but libraries are now offering online ways to read books and stuff too. So that's another option, that you can access these materials online. So.
Right. And even, trying to have toys that represent um, different races and backgrounds. I think traveling is also another way to have your children experience different cultures. Of course, right now it's a little bit different, but hopefully as things normalize and you have that opportunity, traveling, taking your children to different um, places.
Sure, and expose them to different backgrounds and cultures and foods and just different lifestyles, different ethnicities.
Absolutely. You can also talk to your children about if they have any personal experiences with being treated unfairly or being discriminated, and or if they've seen anyone else have that experience.
You might be surprised you didn't realize it, but your child may have, stories of themselves or a friend or someone else they know who's been treated, who's been discriminated against.
And to lead into that, it's important to talk to your children that if they do see something like that, to speak up about it.
Absolutely. So, something not just to be silent about it, but just to make a statement that that's not right, and to be the person who kind of speaks up. Absolutely.
So I doing the research for this Facebook Live event today, I came across this wonderful analogy about how to talk to your child about appreciating differences and diversity in our world. So I'm just going to present these questions to you that you can ask your child. How would you feel if all of your crayons were the same color? Would you be able to draw colorful pictures? Or would your pictures be really boring because you could only use one color? Having different colors is really good and makes things better because it shows that your picture is creative and not the same.
And I think that's just a wonderful example of diversity, right? A box of 64 Crayola crayons. Every single one's different, and together they make beautiful pictures. They make life beautiful, right? So, that's a great way to talk to a young child about diversity.
And then it's about highlighting what makes people unique, and what makes this world a beautiful place. And you can even point out differences in your own family.
Absolutely. Everybody's very different, and you celebrate the differences, right? The differences really come together and make things better.
Right, and as parents, we can be good role models.
Absolutely. And that's really what's important is modeling that good behavior, right? Modeling the sticking up for anybody who's discriminated against, and modeling that you support diversity and tolerance.
Right, absolutely. So I think we're going to now briefly talk about the second topic today.
And our second topic today is about kind of teen mental health. And when we first kind of came up with this topic, we thought initially about kind of COVID, right? Because, this is a stressful environment. But it really expands to so many different aspects of stress and mental health. And, just a brief statement, of course, and this is somewhat obvious, but COVID, the stress, the fear, the uncertainty of this COVID pandemic has really taken a toll on families and children and teenagers especially. Many teens have, they didn't have a formal graduation, right? They're seniors and they were supposed to be graduating, and they didn't have that, or they didn't have their last, their final school week or senior week or whatever.
They have prom or being able to go on beach week.
Absolutely. They've missed out on so many things, and you can see why they'd be stressed, right? And so feeling just, depressed, hopeless, anxious, angry during this crisis just really may be signs that teens need more support. So we just wanted to bring this up and make you aware and try to give you some resources and tips to help.
Right. And the first, I feel like the most important is just being there for your child.
Absolutely.
And just sitting there and listening to them, as we had discussed before, just checking in with them.
Absolutely. Just, are you doing okay? Have a meal together. I know everybody's busy, but at least try to have one meal a day together. Studies show that families who eat together one meal a day, really their kids have many, many less emotional and mental problems. So.
And also having a good routine set up during the day as well.
Absolutely. So, you know, even with all of this uncertainty and schools had stopped, you know, physical, you know, going to school physically, still trying to maintain routine. And even in the summer, trying to maintain a routine, even though swim teams aren't occurring and regular activities, really camps are kind of not really happening very much. But trying to maintain some regularity and some routine is a big thing.
And different people show different signs of how they are addressing and taking this emotionally.
Absolutely.
And it's okay for your child to be sad at times, for them to be crying because they, you know, had a lot of missed opportunities and maybe had expectations, and especially over the summer.
Absolutely. They're missing out on maybe a trip that they wanted to go on, or they're missing seeing their friends. That's very normal. And, you know, trying just to be aware of that, and that's that whole checking in and making sure that they're doing it.
Right. So again, your children may show signs. There's some signs that are normal, and then there's some signs that are red flags that you just need to be more aware of, that your child may need to have that extra support.
Right. And a big thing really is the mood. So you know your child best. If your child is just not acting like they normally do, they're irritable, but it's going on for weeks, right? It's not just 1 or 2 days of irritability. It's been going on for a while now, or they're feeling hopeless, or they're more angry than they normally are, or more conflicts with friends or family. That's a red flag, right? So that's something that's out of the ordinary for your child.
So changes in their behavior, if they are stepping back from personal relationships. So if they're used to texting or video chatting with their friends, or being able to meet their friends outside with obviously appropriate physical distancing, and all of a sudden they don't want to do that. They just want to be isolated in their room.
Right. That's a big red flag. And another, you know, lack of concern and activity. So maybe they used to love to play guitar or play the piano or something, and now they really don't no interest in doing it. So kind of a loss of interest in hobbies or things they previously enjoyed. That's something to be concerned about.
And also, if they have difficulty sleeping, difficulty falling asleep, or frequent awakening during the middle of the night, or they're sleeping too much. And that's why routine's important, because their sleep schedule may be thrown off in general if they are sleeping all day and staying up all night. But, you know, if they are still having a normal routine and they just want to sleep all day and are very apathetic and just not as motivated, then that's another indication as well.
Absolutely. So it could be too little or too much sleep. And of course teenagers like to sleep in general, but just something you know it's just not quite right for your teenager.
So along with sleep, you know, eating. Again, eating may be thrown off with their different routines now. But if you do notice that they are skipping a lot more meals, they're just saying that, oh, I'm not hungry. So they really have a significant change in their eating pattern, or there's all of a sudden eating too much, or eating all the time.
Right, overeating, right? They're kind of medicating by eating, you know, more food, kind of like a medicine for them. Or, you know, even memory problems. So obviously teens can be forgetful, and you know your child best, but really they just can't concentrate, they can't think, and they're usually a pretty organized teenager. That's something to be concerned about.
So if they're having difficulty focusing, difficulty concentrating, you know, if they're normally doing their chores, or they have responsibilities at home, and all of a sudden they're just forgetting to do that, and you have to keep constant reminders for them.
And there's something going on there. And even changes in appearance. So a normal, like if your teen is normally someone who gets up, gets dressed, wants to look their best, and they're slacking off on this in a significant way. Obviously, some teens, you know, aren't as focused on their hygiene. But if your teen is normally focused on hygiene and they're really sliding, then that's something to be concerned about.
And then even scarier is that they start, you know, showing risky behaviors.
Right. Maybe running away from home, or you find drugs, or they found them using alcohol. Those obviously are very big red flags and concerns.
And then something, that's, I think, a, a more critical um, red flag is if they are talking about suicide or about death, or if you feel like they may have thoughts about that.
Absolutely, and even just a word about suicide risk in teens. You must take it seriously. Whether it's serious or not, you have to take discussion by a teenager of suicide or death as a serious matter, right? So that's something that you really need to follow closely. You need to investigate. You need to be with that teen and making sure you know what he or she's doing all the time if they're talking like that.
I would definitely, sit down with your child, get an idea of what's in their mind. You may need to reach out to someone. The first step is talking to your pediatrician.
And that's why we're here, because we really that's a perfect opportunity to reach out to the pediatrician.
But before anything, you have to make sure that your home environment is safe.
Right, absolutely. And safe in a home environment is going to be, if you have weapons or guns in your house, that they're locked up and their ammunition stored separately, right? You don't want any teenager to make a rash, be upset and rashly find a gun. And obviously, locking up your knives, locking up medications, anything that, and when we say medicines, even things like Tylenol and Motrin, right, are things that need to be, even over-the-counter common everyday medicines need to be kept under lock or hidden away from the teens.
Absolutely.
If you're concerned about their behavior.
And make sure that there's always someone with them in the house. Don't isolate them. Don't leave them alone.
Right. Because you don't want them to make a rash decision at a time when they're kind of feeling really down.
And even you may even call one of their friends.
Right.
And reach out if your child doesn't feel comfortable talking with you.
Right.
They may be comfortable talking with another family member.
Absolutely. And we also have some resources, but obviously if you're really concerned about an imminent danger to your teenager, like your child may hurt him or herself or wants to hurt someone else, the National Suicide Prevention Lifeline is 1-800-273-TALK, T-A-L-K. And there's also a crisis line that you can text. So, and that's TALK, you text T-A-L-K to 741-741. That's pretty easy to remember. So, and then everyone's like, when would I call 911? And really, you reserve that when you're very scared about whether you can keep your child safe, right? If you think they're going to really imminently harm themselves, that's the time.
Or someone else in the house.
Or someone else in the house, exactly. So you fear for their safety or your own or someone else's in the house safety. But in a non-crisis situation, the pediatrician is the perfect place to talk, bring in your child, or do a video visit, televisit. So.
We're here for you to address your mental health concerns. We're just here as a sounding board. If you just want to talk to us, we're able to talk to you privately. We can even talk to your child privately, so they feel like they have an open, safe place to talk as well.
Absolutely. And for the visits, the teenager does need to be present, but we can do visits where we talk separately if you don't want to say everything in front of the teenager.
And even for our annual checkups in our adolescent population, we do screen for mental health to be able to identify children that may have some concerns that may not be obvious to you as a parent. Or you may have concerns, but the child may not bring it up even when we do speak to them privately.
Absolutely, and that's why it's so important that teenagers and all children maintain coming in every year for their annual physical. So even though things are kind of falling off and people may not be going to all their doctor visits, it's really important that your children and your teenagers still come in, because we're checking on them, we're making sure they're feeling okay, and we do have the screening tools that have shown to be important to you. So that's just another plug to make sure you come in for your annual physical.
Absolutely. So, in general, in conclusion, it's just important to have an open line of communication.
Absolutely.
With your teen, with your child's pediatrician, And we're here for you.
Yes, that's right. We're here for you, and that's and don't feel alone. And we are here, and there are resources for you. So, and again, as the parent, remember to kind of set the tone, right? Set the tone for tolerability. Set the tone for positive behavior. Set the tone for positive thinking, right? I mean, you don't want to ignore a teenager who's feeling down, but try to be positive yourself and not at least show your teen that you're worried about situations or when you're upset. So,
Absolutely.
and keep those lines of communications open, right? It's a very fine line with teenagers. Obviously, they want their privacy, but you need to be in there to some extent. So try to balance privacy with still keeping those lines of communication open.
And just staying positive that things will get better.
Absolutely.
So
So that's kind of our talk for today. And remember, we are here for your children and to help guide you through young children through adulthood. So.
if you have any questions about what we've discussed today, feel free to leave it in our Facebook comment section or give our office a call. It's, again, a very difficult time for all of us, and we're all going into uncharted territory.
Absolutely.
Thank you again for joining us today for our Facebook Live event.
Thank you very much.